Good morning and welcome to another edition of United Way for Southeastern Michigan's What's the Word Wednesday. My name is Audrey Walker and today we will be learning more about the COVID-19 vaccines. In the last 10 minutes of today's conversation will be reserved for questions. So please leave your questions in the Q&A box if you're watching on Zoom or in the comment box on Facebook. COVID-19 has been part of our lives for longer than any of us have anticipated. And now with the vaccines readily available, things are starting to get back to normal. But we know there are a lot of questions and concerns about these vaccines, which is why we wanted to bring an expert on today to answer all of your questions. We are pleased to be joined by epidemiologist and public health professional, Dr. Debra Furr-Holden. Dr. Furr-Holden holds many roles. She is the Associate Dean for Public Health Integration, C.S. Mott Endowed Professor of Public Health, and Director of the Division of Public Health at Michigan State University. Go Green. She is also the Director of Flint Center for Health Equity Solutions, funded by National Institute on Minority Health and Health Disparities. Dr. Furr-Holden's community-based, action-oriented research has driven multiple policy interventions to address some of the nation's greatest public health challenges, especially among racial and ethnic minorities and in racial and economically segregated communities. Dr. Furr-Holden has earned her bachelor's and PhD from Johns Hopkins University. Thank you so much for joining us today. We're so glad you're here.
Thanks for having me. I'm excited. I've been sharing a lot about the vaccines, and as a public health professional, there's a really great model that I love. It's called the Swiss cheese model of pandemic defense. And the thinking is, if you think about Swiss cheese, right, it has holes in it. Mm-hmm. So if the Swiss cheese was your layer of protection between you and the vaccine, one piece of Swiss cheese wouldn't be enough, right? Imagine if your mask had holes in it. But as you start to stack up multiple layers of Swiss cheese, these individual layers that might be imperfect as a standalone layer, but as you start to stack multiple layers up, if you notice in a whole loaf of Swiss cheese, the holes don't go all the way through. So as you start to stack those layers up, you start to build this protective wall of defense. And there are many layers in that Swiss cheese model of pandemic defense and viral defense that help us, and the vaccine being one imperfect but important layer in that kind of setup. Same thing with your mask, right? Just wearing a mask in and of itself might not be sufficient, but if you wear a mask, if you practice good hand hygiene, if you monitor and watch your distance and density, how many people you're around, how long you're in crowded spaces, if you get vaccinated, if you have support at your job, or in your community to be able to shelter in place, as you start to stack all of those things up, you've got this really great wall of protection in between you and the virus. And so that's our public health lesson for today. Multiple layers improve success. Because the thing about the COVID vaccine is it was not meant to be the end all be all. And if you remember back earlier in the pandemic, we were talking about flattening the curve. And it's really funny because I'm an epidemiologist. I've been an epidemiologist sort of card carrying for more than 20 years. And now everybody knows what an epidemiologist does. And everybody knows what an epidemic is and a pandemic, right? So we've got this epidemic. We've got this disease that's in excess of anything we could have ever expected because it's new to us. And it's happening on a global scale, i.e. it's a pandemic. And so as we think about what the vaccine was to provide, we flattened the curve in COVID early in the pandemic in the absence of a vaccine. And how did we do that? We did that with public health and prevention. We did things like, created public health precautions, encouraging people to honor protocols. And I always tell them the 3 W's: wear your mask, wash your hands, watch your distance. We saw great strides with that. I do know that took a toll on people because it was tough to shelter in place. Some people didn't have the luxury of having the type of job where you could just do what I did and switch over to Zoom and take over every room in your house. My kids joke that I have 4 offices in the house now. One in the kitchen, in the dining room, one in my real office, one sort of in a family space, and one downstairs. A lot of people didn't have that. But then we saw things like payroll protection and enhanced unemployment and things like that that provided protection for people. So what the vaccine has the potential to do is to be the game changer. If you think back to that Swiss cheese model, we've got all of these layers, no one perfect, but again, building multiple layers will improve our chances of success. So the real goal is to keep many of those layers in place and add this important potential game changer, this last layer. And the layer that came right before that, I think, were the many therapeutic interventions that we created to help treat people who contracted COVID. So let's talk specifically about the vaccine. Most of my work has been focused on health equity. I do a lot of work around racial equity, but I want to note that racial equity is not the only inequity that we face in health and healthcare. We see tremendous disparities for people who live in rural communities, for people who have disabilities, for sexual and gender minorities, and other populations. That's just sort of the area that I've focused mostly on, is racial equity. But we have lots of inequities and lots of groups who've not had adequate access to health and health care in our system. And I always tell people, COVID didn't create the problem. COVID gave us the inescapable opportunity to look at and see the problem. It sort of shined a light, if you will. So now we're at this interesting spot. When the vaccine first came out, we had more people who wanted it than we had vaccine available. That's a classic supply-demand problem. Demand was high, supply was low. We've gotten now, the sort of new headline for today is about 50% of all Americans have been vaccinated. In Michigan, the numbers are just a little bit lower than that, but we're sort of reaching that sweet spot where we've got about half of the population vaccinated. So many of the issues that we saw in equity and vaccine distribution and administration have somewhat solved themselves, because most people who want to get a shot in the arm now have some access to be able to do that. So the question is, how do we sort of bridge that gap for the other 50% of our population? The people who are, and I say legitimately and validly, still on the fence, still grappling, still questioning, still wondering. People ask me all the time, why should I get the vaccine? You said it's an imperfect layer, important but imperfect. So if I still have to get my mask, why would I wear the why would I want to get the vaccine? And there's a couple of things I want to note for people. While imperfect, it is important. When you hear the 95, 96% effectiveness rate, and we've all had to balance that against this new thing we've heard about called breakthrough cases, right? What 95, 96% effectiveness means is that 4 to 5% of the time, the vaccine will fail, meaning you'll get vaccinated and you'll still end up contracting COVID. But here's what the vaccine is really great at. It's really great at preventing people from, one, contracting the disease, two, if they contract the disease, from getting sick and needing to be hospitalized. And the real moneymaker and the real game changer is it's really great at preventing death from COVID-19. So to that end, I think when you balance out the risks associated with the vaccine compared to the benefits, it's not a comparison. And then people say, well, Doc, what about the J&J pause? That bothers me. That scares me. And here's what I'll say about that. The work that we did and the pause on the J&J was a good thing. It's a product of the surveillance and pharmacosurveillance that we all should be doing when we've got new medications and therapeutics introduced into our population. It's actually a signal that things are working as they should be. The blood clots that developed in the people who got the J&J vaccine, I want to be very clear, are very rare, but potentially harmful blood clots. Based on the reports that we had, those occurred in about 1 to 2 per million. The pause gave us an opportunity to really make sure that we had counted the prevalence of those blood clots and that we could identify the profile of who was most at risk for those blood clots. And we could also figure out what is the best standard of care to, one, provide people with information, should they be one of those 1, 2, or 3 in a million who develop a blood clot, how to recognize it, what to do, and then making sure that our great clinicians and healthcare providers know how to treat them. What a lot of people don't know is if you look at the same rate of those extremely rare but potentially lethal blood clots in COVID patients, 18 to 20% of people who are hospitalized for COVID develop those same blood clots. So we're comparing the odds of about 1 or 2 in a million compared to 1 in 5 for hospitalized COVID patients. Like, the numbers are just mind blowing. So the pause was a good thing. And it was a signal and a sign that our system is working. And then people ask me all the time, well, Doc, why should I get the vaccine if we've got all of these variants? And I've been really interested in following what's been happening globally. And for people who don't know, we've got our very own homegrown US variants of COVID. We don't talk about that a lot, and I really don't like the naming of it and attaching the variant to a country, right? People are talking about the UK variant, the South African variant. Nerds like me will talk about, I wouldn't call it the Brazilian variant, we'd call it the, P12 variant or the, but here's what I'll say about that. Most viruses, especially viruses in this family, will mutate. It's a part of their survival mechanism. And viruses have just one main goal: find a host and replicate and survive. Find a host and survive. And if you were trying to go unrecognized and outsmart all of the, innovation and technology and medicine that was available, if you wanted to hide out from somebody, you might put on a hat, you might change your hair, you might change your look up a little bit. That's what viruses do. They change their look up a little bit. But the vaccines that we have are pretty good at recognizing, Audrey, if you, decided you were going to try to walk past me without being noticed and you turned your head to the side, I'd still notice you even if your hair was covering half your face. That's how the vaccines work. They seem to be still pretty good at identifying the virus when it comes into the human body, even though it may have made a few minor alterations. What happens, though, is over time, as those mutations persist and continue to the virus continues to change over time, our bodies may have a lower ability with the immune response that we develop to continue to detect those. So I'm telling folks, be prepared that, very similar to the flu, this may be a protocol that we'll see happen with some frequency. We've heard a little bit of conversation around boosters and things like that. So I just tell people, this is a new virus, not the family. Coronavirus family is not new to the human population, but this particular coronavirus is. And we all have to be willing to be nimble. Remember, there was the time when they said the world was flat, and so people would only go but so far for fear they'd fall off the edge. You don't have to worry about falling off the edge. We've got some of our nation's best scientists at the forefront of discovery around this virus. And the best thing that we can do is all do our part and practice prevention to stop the spread, which will also slow the spread and the manifestation of these various viruses. I want to make 2 more points around vaccine hesitancy. And you can talk about it in terms of hesitancy or confidence or other things. And I always tell one on myself. When the vaccines first came out, I was a no way. I remember in December getting a survey. I'm at Michigan State University in the College of Human Medicine. I'm a part of our, medical enterprise. We train medical students and residents, so I'm considered a hospital partner, and was actually eligible in that category of 1A people because I am connected to a healthcare enterprise. And my thinking was, I need to wait and see. I want to wait and see. And that happened in December. And I personally have lost loved ones to COVID-19. So it wasn't because I didn't think that this was real or that I don't understand that there are potential, not just lethal consequences, because there are many people have died from COVID, but we're also understanding now that there's something outside of death, right? People get sick. We're learning about long haulers and long COVID, the long-term impacts that this virus takes in the human body. What people don't realize often is where this virus bonds in your body. These ACE2 receptors are everywhere. They're in your brain, in your heart, in your lungs. They're in your reproductive organs. So COVID has the potential to impact every, almost major system in your body. And so I was a no. I was a no in December. And then January rolled around and I got more and more information. I'm an epidemiologist, so I could make a little bit more sense probably than the average bear. of what I saw in what's called the Data Safety and Monitoring Report that was generated by a team of independent scientists. They don't work for the pharmaceutical companies. They don't even necessarily work for the government. They're independent scientists who are experts of varying types of expertise who review the data and make sure that the vaccine is safe for use in the population. And I had to make a real sort of decision for myself. Do I trust my colleagues? And I actually know people who were part of the Data Safety and Monitoring Board, and I trust them. And so it took me about 3 or 4 weeks from my initial no way in December until late January, when I actually got an opportunity to be able to get the vaccine to be a yes. But that yes was a very empowered yes. I said yes because I had good information. I had all my questions answered, and I was able to adequately balance out the risks and the benefits and freely choose. And so I just encourage people, if you're still grappling, if you have questions, get those questions answered. What I know, because I was able to do the work and make sense of it and make a powerful choice for myself and my family, is that even people that I know who've gotten COVID, most of them have said, I wish the vaccine were available before I contracted this disease. I do know people who are dealing with long-term symptoms, whose sense of taste and smell hasn't returned after 3 or 4 months. People who have ongoing problems with their breathing, or what they call brain fog or COVID fog, the ringing in the ears, you name it, we're seeing it in our population. So if people are hesitant, my encouragement for them is get those questions answered. Talk to your primary care provider. If you don't have a primary care provider, we are in a new era. Affordable care has become way more affordable. If you don't have a primary health care provider, or you're uninsured or underinsured, reach out to your local federally qualified health center. These places tend to be stakes in the ground for people in community to be able to have a primary care provider who will work with them on their health team and help get questions answered.
Mm-hmm.
And lastly, if you're in that very small group of people who don't know how or where to get the vaccine, I think the best resources, there's a federal resource for people. Now, this resource has a limitation in that it only lists federal vaccine sites. There's 3 ways you can do it. You can go to vaccines.gov, and there's the vaccine finder. Again, it only lists the federal sites. It might not list sites that are sponsored by your local health department or even the state. You can also text the word vaccine to the number 438-829. You put in your zip code, and it'll give you a list of all the federal vaccine sites. And now many of these sites take people with no appointments needed. So that whole thing of being stuck on a wait list, caught in the maze, that's mostly gone. Now, most of these places are walk-in, no appointments available. And then there's also a 1-800 number you can call, which is 1-800-232-0233. And again, this will give you federal resources for vaccination sites. And then I always encourage people, reach out to your local health department and go on your local health department website, because those places will also list the community sites. And know that there's a Dr. Debra Furr-Holden or somebody like me in many communities who want nothing more than to answer all of your questions so you can make a choice that's going to protect and preserve your health and the health of your family and the people you care about.
Yeah. Well, thank you so much for all of that wonderful information, and not only the information, but really sharing your experience and your story about, why you chose to get vaccinated and just kind of the whole background of that. I think that really helps reassure people. We do have a couple of questions here, and if you like to answer or ask any questions, you can put it in the Q&A box on Zoom or the comment box on Facebook. But our first question here comes from a family where it says, my husband and I are vaccinated, but we have a little one in the home that can't be vaccinated. What should we do to keep younger kids safe?
I got it. That's a really great question. So the vaccine, age 4 eligible vaccinations for, and I'm going to stay away from brands, but I will say vaccines are now available for children as young as 12. And the clinical trials are underway, and we're very close to adding additional younger ages to that eligibility group. So what I encourage is build a hedge of protection around those who are not vaccine eligible. And people may not be vaccine eligible because of their age, they're under 12. They may not be vaccine eligible because they're immunocompromised.
Mm-hmm.
I have a friend who's in the midst of cancer treatment, and her physician has recommended that she not be vaccinated until that treatment is complete. Why? Because her immune system is probably at its weakest right now. So build a hedge of protection. And how you build a hedge of protection is all the people in your group, in your family, in your household, in your workplace who are eligible should get vaccinated. And then continue to honor the protocols, especially for those who are not vaccine eligible. So despite whatever federal recommendations or federal new guidelines get issued, continue to honor the protocols of public health and prevention. Continue to wear your mask, continue to practice good hand hygiene and wash your hands. And also watch, I say, your distance, how close you are to others, your density, how many people you're around at the same time, and your duration, how long you spend time in places that might put you or your loved ones at risk.
Mm-hmm. Yeah, and those last two are definitely good points to consider that we might not always think about, especially as more and more people are getting vaccinated and gathering as well. So we have another question here too, and it's kind of a two-part question, but there was a question of what should I do if I miss my second dose of Pfizer, Moderna, and or what happens if I wait to get the second? Like, is there a period of waiting where then it would negate the first round or anything like that?
It doesn't negate the first round. And so here's what I always tell people about that. One, we have the clinical guidelines and recommendations. So for Pfizer, it's 21 days in between the first dose and the second dose. For Moderna, it's the guideline is 28 days. You can go, and I don't tell people this so that they practice this. This is not, this is like plan B if something bad happens that limits you or prevents you from being able to get that second dose in that time window. We're now understanding, because we've got more and more people who've been vaccinated. When we tested the vaccines out, we did it in a clinical setting, and it's called efficacy. And efficacy is how well something works under ideal conditions. And then there's where we are now, which is understanding effectiveness. And effectiveness is how well something works in the real world in less than ideal conditions, which is what the real world is. Hello, right. This whole COVID thing is very much less than ideal conditions.
Right.
And we're finding that people can have up to 40, 45 days, independent of which 2-dose vaccine they get, and still get the full protection. So what happens if you only get 1 dose? You do still have some protection. But the effectiveness that we hear, the 94, 95, 96%, comes with getting the 2 doses of the vaccine, ideally in that recommended time window. But do know we understand more now. And even if you were to go up to 40, 45 days, it looks like you still can get that 95, 96% protection. So if you missed your second dose, if something happened, my recommendation is as soon as you can, go back in and get that second dose. And I do encourage people also consider and do not be wary about the 1-dose Johnson & Johnson vaccine. That vaccine is safe and will definitely provide more benefit and protection for our community than the limited risk of harm from those very rare blood clots.
And then do you have to go to the same place to get both your doses?
Technically, you do not have to go to the same place to get your doses. The ideal scenario is you will do that. You will be issued a card when you get your vaccine. That card is important. So here's what I tell people to do, and this is what I did. When I got my vaccine card, because we've all lost a card, I've lost my driver's license before.
Right.
When you get that card, I immediately took a picture of it on my cell phone.
Yes.
Why? Because what's on my cell phone gets backed up to some magical cloud somewhere, and I know I'll always have a copy of it. And then I took that card, and it's a little bit bigger than my wallet is, so I just folded the top of it over so I could slide it into the place where the money goes in my wallet, and I keep it in my wallet, and I kept it in my wallet until I got my second dose, and it's still there now because I treat it as important as I treat my driver's license. But there's more information on that card than simply which vaccine you got, right? And it is important. If you got the Pfizer for your first shot, you should and must be getting the Pfizer vaccine for your second shot. You got Moderna for your first shot, you have to get the Moderna for your second shot. If you are able to get it in the same place, that is great. They have record that you were there. If you don't, you just need your vaccine card. But the other information that's on that card, which is so critical, is it has a batch number. So we know not just which vaccine you got, but from which batch of vaccines that were distributed yours came from. Just in case. And again, this is the system working. We've got what's called pharmacosurveillance. We are monitoring any type of adverse events and effectiveness of the vaccine out in community. And some people may have heard there was a glitch with the factory in Baltimore with some, how vaccines were manufactured. And so all of that had to be thrown out, et cetera. That vaccine card contains really important information that will link you to the specific vaccine that you got and the batch that it came from. So you do not have to get it in the same place, but you do have to get the same brand.
And then we only have time maybe for one more question here, but there was a lot of questions kind of around like, okay, I got the vaccine, but maybe my husband doesn't want to get it. Or, my daughter's going to college in the fall and she got the vaccine, but what if her roommate doesn't get it? Like, are there tips that you have for either conversations around that? Or I know you talked about the layers of prevention that we can all do, but I didn't know if you had any other thoughts on that.
I always tell people you are the best, most trusted and credible messenger in your sphere of influence. I do think it's important that we honor people where they are. Some people are no or not right now. And sometimes that's just based on misinformation, or it's based on limited information. They may understand some of the risks, but they don't fully understand all of the benefit. I have a daughter, she's pregnant, and it took about 3 months of conversation and dialogue for her to make the choice to get the vaccine. And what tipped the scales for her is when I told her, we now have the data. The virus will pass the placenta. If you get COVID, your baby will get COVID. And we've seen now in Brazil, many hundreds of cases of women whose babies have died in the womb and been born, stillborn, and been tested positive for COVID. What's cool is once she learned the information that the virus passes the placenta, the vaccine does not, but the antibodies do. Okay. So if you get the vaccine, your baby will be born with COVID antibodies, and your baby will get your antibodies. So it is about giving people that good information. So if you're vaccinated and you're around people who are not, share your experience. Worst thing that happened for me, I had a sore arm. I didn't spike a fever. I didn't get tired. I know people who had that. Right. But be that trusted, credible messenger and still practice prevention.
Well, again, we really appreciate all the valuable information and experiences that you've been able to share with us today. And it's so important to help us kind of sort out some of these myths from the facts on vaccines. So I do hope this town hall has given everybody some assurances they need to feel confident and make decisions around getting vaccinated. So thank you again for that. As a reminder, for those of you who may be experiencing a need, our 211 helpline remains available 24 hours a day, 7 days a week, and we maintain a running list of available services in the community that can connect you to the supports you need. And you can also look up resources in your area by using our 211 resource database at unitedwaysem.org/211. Our next town hall, so next week we'll be kicking off Pride Month with David Garcia, Executive Director of Affirmations. And you can see our previous town halls and more upcoming topics at unitedwaysem.org/virtual town halls. And the website is also included in the chat box. So again, we want to thank you all for being here. We hope to see you again next Wednesday, and please stay safe.